want to start? Thank you so very much.
Okay. Hi, my name is Julie. I'm with Northside today. I work in mental health. I'm an individual therapist. I do supportive case management. And I'm out here today because, you know, the people that I work with, the people that struggle on a fixed income or no income, really need supportive services in order to maintain the level of independence that they currently have. They're the ones that are on the chopping block with these proposed budget cuts. And, you know, these are awesome people. Just because they don't have just because they don't have 9 houses plus the governor's mansion, they deserve to be able to live happy and independent lives. And they just need a little bit extra help. And I don't know anybody who, at one point or another, didn't need extra help in their life. So, you know, I think it would be selfish, and I'll go so far as to say ignorant, to think that, you know, you can just take away supportive services from people and think that it's not a big deal. So that's why I'm out here today with some awesome people.
Woo! Yeah! Yes, you got it.
Does that sound okay?
All right. Fine. Thank you.
Yeah.
And so, how many people work with you? And do you work at a clinic, or are you a
Yeah, I work
regional?
in a day program. A day program that I believe used to have 7 full-time staff and now has 2. We, you know, normally we would see about 40 to 50 people a day, but because the affordable housing has been pushed out of the north side, a lot of our participants had to be housed on the south side, you know, hour plus away from their services, so they don't access the resource or the program I work at as much. So now we see about 20 or 30 people a day. So we're already seeing people drop off and get lost to care because of, you know, being ostracized from their communities. And I won't let it happen, continue to happen like that, because it's not fair.
I wanted to bring that up because in addition to the client fall off, we're talking about sustaining jobs that are disappearing in the care industry.
Yeah, no, that's a great point, because, I mean, with C4, we just saw all those cuts, and one of my colleagues kind of mentioned, you know, we definitely care about the participants that have lost their source of support, but also the staff, I mean, who put some of them years of service into an agency and really believed in its mission. And, you know, because of mismanagement of funds, because of budget cuts, you know, those people aren't able to do what, you know, they live to do anymore. And hopefully they'll be able to get absorbed by other agencies, but C4 was a great place that served 10,000 people. I mean, that is going to be sorely missed.
And as we know, in some neighborhoods, healthcare and health providing jobs are some of the most sustaining jobs in the area.
It's very true. I mean, they're not very well paying, but they pay off in another way, because, you know, you're doing good for the community and you're helping people. I mean, even if it's baby steps, you can see the changes that you're making. And I mean, it's going to be a hard hit.
And